Welcome to Module 1, Finding Your Voice, Advocacy Foundations for Emerging Professionals. I am Dr. Linda Horn, a physical therapist, and I want to share with you the importance of advocacy. By the end of this video, you will be able to define advocacy and what it means to you, discuss how advocacy determines the well-being of your patients, your scope of practice, and your income, and recognize how advocacy aligned with APTA's mission and your personal professional growth. What is advocacy? According to the Oxford Languages Dictionary online, advocacy is public support for or recommendation of a particular cause or policy. Many times, advocacy is associated with politics. And while it does involve politics, it is much more. Advocacy efforts improve access to care and equity for our patients and allows physical therapists and physical therapist assistants to provide excellent care. PTs and PTAs' advocacy efforts can significantly change healthcare policy and improve community health. There are many types of advocacy. Personal advocacy is about you advocating for yourself. This could occur in the classroom as you advocate for changes or when you negotiate benefits as an employee. Patient advocacy. As PTs and PTAs, we advocate for our patients every day. This is an important aspect of the care we provide to patients. We advocate to get more equipment, more visits, or a specific level of post-acute care. We look for community resources for patients who have food or housing insecurity, or resources for education and support groups. Professional advocacy is our duty as a professional. Professional advocacy involves having a relationship with your legislators at both the state and federal level to educate them about issues important to improve the health of our patients. Many legislative issues are about improving access to care, appropriate reimbursement, and scope of practice issues. Scope of practice issues may include adding something to the practice of physical therapy or opposing other professions from adding practices that may be unsafe due to their level or type of education. Organizational advocacy is the interaction between people, the organization, the workplace community, and the community it serves. Examples of this level of advocacy may be internal, such as education about when it's important to refer a patient to physical therapy, or external, such as participating in community health events. Societal advocacy is advocacy for human rights and injustice from a systemic point of view. These issues are about health equity, such as accessibility on campuses and in the community. Why should you advocate? I think Dr. Seuss said it best. Unless someone like you cares a whole awful lot, nothing is going to get better. It's not. Do not depend on others to advocate for you. Each voice is important, and your legislator wants to hear from you. And the time to start your advocacy efforts is now, not later. Additionally, the APTA Code of Ethics for PTs and PTAs includes societal responsibility. This principle states that physical therapists and physical therapist assistants shall participate in efforts to meet the health needs of people locally, nationally, and globally. You can make a difference. There are 2 action items for you to do after you have listened to this module. First, explore the APTA and the Academy or section member benefits. Membership is important to stay up to date and engaged. Secondly, create 1 social media post asking your network to create or contact a legislator on an issue important to you. This could be a local issue related to your community or a healthcare issue. If you are not sure of the current issues, look at the APTA advocacy website or contact your state chapter to learn about the current professional issues. As you begin your advocacy journey, remember that your voice matters.